I am Professor Dr. Dharmesh H.S, practicing implantologist. I have made few videos based on the most frequently asked questions or queries about the implants. Risks involved in dental implants. The purpose of this video is to explain the possible risks involved in dental implants. The dental implant procedure involves two stages. The first stage is the surgical stage. In this stage, implant is placed in the jaw bone and it is usually done under local anesthesia. Number 2 is the second stage, the implant tooth restoration stage. It involves exposure and evaluation of implant to determine if the implant has successfully locked into the jawbone, followed by placement of prosthesis, that is a crown or a bridge or a denture. There is always some risk involved in any type of surgery. The risks associated with dental implants can be in the surgical stage or the tooth restoration stage. First, we will see what are the surgical risks. Number 1 is bleeding, number 2 is infection, number 3 is swelling, number 4 is pain, number 5 is facial bruising. Other severe risks which are rare but can occur are bone fracturing in areas where the jaw is thin, muscle spasm, injuries to the temporomandibular joint, damage to adjacent tooth roots which may need root canal treatment at a later stage. In the lower jaw, damage to the sensory nerve at the surgical site. This damage to nerve can cause numbness, pain or tingling sensation in the lips, chin and tongue. This numbness is usually temporary, but rarely it might be permanent. In the upper jaw, sinus or nasal perforation during implant surgery and sinus infection. All the above mentioned complications can be avoided if diagnosed and treated appropriately. The complications can be treated with medications or surgery. The medications are analgesics, that is the painkillers to reduce pain, antibiotics to avoid or treat infection, steroids to avoid inflammation. Surgical risks. It is very important to note that sometimes it might be necessary to carry out additional surgery to rectify the problem. Implant surgery is thoroughly planned, but sometimes during or after implant procedure, it may reveal that implant is not possible. In such cases, we will suggest you an alternative solution. Healing varies from person to person. Therefore, the duration of the whole procedure varies. Implant tooth restoration risk. They are failure of the implant to lock in the bone, causing a loose implant, fracture of implant parts causing the tooth to come off the post, fracture of the crown. All these above mentioned problems can be resolved. It might be necessary to perform an additional surgical procedure to remove a failed or broken implant, and an additional cost may be incurred if we have to replace an implant. To ensure the success of dental implant procedure, we do undertake a thorough medical evaluation and dental examination. We suggest you dental x-rays and CT scans for precise placement of dental implants and avoid or minimize the risk. Based on all medical, dental and scan reports, we develop an individualistic treatment plan for you and explain the number, the design, the size of the implants, duration of the treatment, cost and risks involved in the procedure. Make sure you understand the cost, risk, and benefit factor involved in the implant treatment procedure to have a realistic expectations about dental implants. If you don't understand, ask your implantologist for more explanation. I tell you again, if you don't understand, ask your implantologist for more explanation. For more information, log into my YouTube channel, and you can also contact me on 9900008081. Please share these videos among your friends and family members to spread the right information about implants. Thank you.